A groundbreaking study conducted by leading health experts has revealed strategies to prevent diabetes among women aged 40 and above. With diabetes becoming increasingly prevalent worldwide, especially among older women, this research offers tailored insights to mitigate the risk factors and promote healthier lifestyles. The study, conducted over a span of 5 years and encompassing a diverse sample of over 10,000 women aged 40 and above, identified several key factors contributing to the onset of diabetes in this demographic. Sedentary lifestyles, poor dietary habits, and genetic predispositions were among the primary culprits. Dr. Emily Rodriguez, lead researcher and renowned endocrinologist, emphasized the importance of proactive measures in combating diabetes among women over 40. Prevention is paramount, she stated. By adopting certain lifestyle modifications and incorporating healthier habits, we can significantly reduce the incidence of diabetes in this vulnerable demographic. Now, the study outlined the following strategies as effective means of diabetes prevention for women over 40. Number one, regular physical activities. I know you didn't want to hear this, but it's practically always included in anything with staying healthy. We need to engage in at least moderate intensity exercise for at least 30 minutes a day. And this includes brisk walking, cycling, or swimming. Any of these can substantially lower the risk of developing diabetes. Now, incorporating strength training as well, at least 2 or 3 times a week, also aids in improving insulin sensitivity and glucose metabolism. So yes, pull out those free weights, ladies. Get some strength training in there. And then number two, healthy diet choices. Adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins is always instrumental in preventing any disease as well as diabetes. Now, limiting the consumption of processed foods, sugary beverages, and refined carbohydrates helps to regulate blood sugar levels and maintain optimal weight. And while we're talking about weight, number three, weight management. Maintaining a healthy weight through a combination of regular exercise and mindful eating is crucial for diabetes prevention. Even modest weight loss can significantly reduce the risk of diabetes and its associated complications among women over 40. Number four, regular health screenings. Routine medical checkups, including blood glucose monitoring and lipid profiles, are essential for early detection of diabetes risk factors. Women aged 40 and above should undergo regular screenings to assess their metabolic health and take preventive measures accordingly. Number five, stress management. Chronic stress can contribute to insulin resistance and metabolic dysfunction, increasing the likelihood of developing diabetes. Incorporating stress reduction techniques such as mindfulness, meditation, yoga, or deep breathing exercises can help mitigate this risk. Dr. Rodriguez emphasized the importance of tailored interventions and personalized approaches in diabetes prevention. Every woman's risk profile is unique, she noted. By addressing individual risk factors and implementing targeted strategies, we can empower women over 40 to take control of their health and reduce their risk of diabetes. In conclusion, as diabetes continue to pose a significant public health challenge, especially among women over 40, the findings of this study offer invaluable insights and actionable strategies for prevention. Now, by prioritizing physical activity, healthy eating, weight management, regular screenings, and stress management, women can proactively reduce their risk of diabetes and enjoy a healthier, more vibrant life in their later years and more to come. For 19 years, Pamela Sams has helped women improve their personal wealth through solid financial life planning, resulting in financial security and greater retirement readiness. Pamela's education and training enables her to help clients successfully navigate through the myriad of financial decisions that they face during their lives. She's a member of the $1 Million Roundtable, which is limited to only the most successful in the financial services profession. This places her among the top professionals in the global life insurance and financial services industry. Pamela is often quoted in various financial resources. She shares her financial knowledge on the speaker circuit and was featured in the Women in Wealth section of Fortune magazine November 2020 as a top wealth manager in the Washington, D.C. metro area. Pamela, welcome back.
Thank you for having me once again. It is awesome to be back
Last,
and
thank you.
sharing with your audience.
Thank you. Last time you joined us, we were the midlife leap. Now we just
Yep,
combined all ages. So I'm
exactly.
excited to have you here to share about a very important topics, Social Security, Medicare, retirement.
Yeah, exactly. So, I mean, those are kind of I guess, the trilogy of things that people have to consider when they start thinking about retirement, especially if they plan to retire early. Just having conversations with people is that, 62 is the earliest that you can take Social Security, but Medicare doesn't kick in until 65. So between 62, if you decide to take Social Security a little bit earlier, until 65, what do you need to do in terms of health insurance? And unfortunately, for most of us, we know if your healthcare is not subsidized through your employer, it could be a little bit costly. So really trying to figure out what do you need in retirement, and then on top of that, if you decide to retire a little bit early, how are you going to plan for your healthcare expenses between, let's say, 62 and 65? So those are really some decisions that you do need to make as in regards to Social Security. Now, if you do decide to take Social Security early, most of everyone's full benefits, if you get your Social Security benefit statement, those green and white statements that they mail out, they don't mail them out anymore, pretty much, Sunita. But I think if you're over 60, you still get it. Everybody else needs to go on the website to get a copy of their statement. But on there, it will be three numbers that people need to be aware of. The first one is age 62. That's the earliest you can receive Social Security benefits. But usually it's reduced by about 25 to 30%, depending on your full retirement age. So the government loves acronyms. So on your statement, you'll see FRA, which is for your full retirement age. So 62 is going to be reduced. Then you have your full retirement age. Depending on the year you were born, that's generally between age 66 and 67. So on the statement, you may see 66 and 2 months, 4 months, 6 months down the line until if you're born over after 1960, then your full retirement age for Social Security will be 67. So if you take anything before 67, reduced. It's also another number that people need to be aware of is that third number, which is age 70. That's the latest that you can take Social Security benefits. Past your full retirement age, you actually receive 8% increase in your what they call delayed credits. So between 67 and 70, you can actually grow your benefit by about 24% between 67 and 70. So it does pay the weight depending on what other types of retirement income sources that you do have. So that's basically Social Security. Medicare. Medicare is the basically the healthcare system for most people in the United States. You pay into it just like Social Security. So on your pay stub, you will see FICA, and everybody knows, what is FICA. It comes out on your paycheck, and it goes to a portion goes to Social Security, a portion goes to Medicare. So that's how those two programs are funded. So it's basically you getting back your benefit through payroll all throughout your years. So let me step back a little bit about Social Security. So Social Security, they take your highest 35 years of earnings. So they're not going to go back way back when you may have had a low paying job or something, working at the ice cream shop when you're 16 or something like that. So they're just really looking at a solid 35 years of earnings. And then that's how they calculate your benefit. So for most people who are with their benefit record, you want to look at your earnings record when you look at your Social Security statement, especially if you're probably somewhere between 5 to 10 years before retirement. You want to get these numbers as accurate as possible. So look at your earnings record because sometimes some things may be missing or it may not be accurate. So challenge the Social Security Administration to say, hey, if something looks wrong or is incomplete, really file it's an appeal or something like that you have to look at your statement and say there were some years that are missing on my earnings statement because that will ultimately affect your benefit. So as you get closer to retirement, you want to make sure that is accurate as possible. So back to Medicare. So Medicare at age 65, again, you pay through payroll tax, and then there's what they call the alphabet soup of Medicare, especially people who are familiar with it. But if those who are not in your audience, there's a Part A. That's the part that you've paid into. So that's, I'm going to say, technically free, but you've been paying into it. So there won't be a premium for Part A. And that covers your hospital benefit through Medicare. There's a Part B, and the Part B premium is like your doctor. So like when you go to the doctor, you pay a copay. Same thing with Medicare. There will be Medicare Part B. However, Medicare Part B has a premium attached to it, and it is based on your adjusted gross income. So each year, your Part B premium could change depending on how much income you take in retirement. Generally, it's within a tax band or a tax bracket. So if you move to a different tax bracket, it could increase a little bit, but for the most part, Part B premium will be dependent on your adjusted gross income. Now, that is individual. So if you are a couple, you will have a Part B premium, and your spouse will have a Part B premium. So in retirement, your healthcare expenses could be a little bit more because it's individualized. It's not like a group plan like you had when you were at work. So, and it's based on your adjusted gross income, like I said. So, unfortunately, if one of you guys pass away, you may be still in the same tax bracket. You still may be paying a higher Part B premium in retirement. So, know those numbers. Um, with Part B premium, there's also a deductible that comes along with that. It changes every year. I think last year was like $340 or so before Medicare would kick in. Medicare only covers 80% of benefit. So the other 20% of what they call a co-insurance that you would have to pay. And that's where people generally get a Medicare supplement or Medigap. You may have heard two different terms, but they're the same thing in order to cover the 20% co-insurance. And with that, of course, Medicare supplement plans will cost an additional cost as well. And that's generally dependent on your age, and then your zip code, unfortunately. So if you live in an area that may not be so great, you may end up paying a little bit more for that. Medicare supplements when you first age into Medicare at age 65, or whenever you come off of what they call credible coverage. So if you work past 65, you can get you would basically qualify for Medicare at that particular point, and then you could basically apply for Medicare and come off of credible coverage for your employer coverage. However, you have a 12-month window, or actually, I'm sorry, 6 months from when you first age into Medicare to apply for a Medicare supplement plan that's guaranteed. After that, basically you are subject to the underwriting, and if something you have some health issues, unfortunately, you could be denied with that. So if you do think you want to get a Medicare supplement plan, with that, you want to do it when you are what they call guaranteed issue, when you first age into Medicare or when you first transfer to Medicare from an employer plan. That's how that one works. There's also a Part C, which is Medicare Advantage. So probably somewhere between October and December, your television commercials are flooded with Medicare Advantage commercials because that's where most people will make changes to their Medicare program and they're allowed to get the Part C Medicare Advantage. Medicare Advantage is basically a bundle. Think of it kind of like your cable program or your basically your telephone where you get the cable, you get the telephone, you get the internet, all of that. Same thing with that Medicare is that Medicare Part C, Medicare Advantage includes Part A, Part B, and also Part D, which is prescription drugs. So
Yeah.
I'm kind of going alphabetical order, but that it kind of works because it's kind of a little bit backwards. But
Mhm.
Medicare Part D is the prescription part of Medicare, and that covers your prescriptions. If you get Advantage, like I said, it's included, so you don't have to get a separate program. If you do what they call original Medicare, you do the kind of the all the moving parts, Part A, B, and D. Then you added a supplement. If you get Advantage, you don't need the supplement because you basically have the bundle at that point.
Mhm.
You're still going to pay Part B premiums if you do Advantage. You're not going to get away from that. That is basically subsidized through, not subsidized, but the program is through the government. So the government's like, we want our little portion of Medicare Part B. So they're still going to charge a premium, and then you will pay a premium to the health insurance company because the health insurance company is basically administering original Medicare to you. It's just through an insurance company, so Part B will still be in play when it comes to that piece. So those are kind of the moving parts of Medicare that you have to be concerned about, as well as Social Security. If you apply for Medicare through the Social Security Administration, don't know how that happened, but that's where you would do it. So if you want to apply for any benefits, Social Security and Medicare, you would do it through SSA.gov, which is the Social Security Administration website, and that's how you would sign up for your benefits. Medicare, if you decide to do your Part B premium without it going to a health insurance company, then you can have it deducted from your Social Security check as well, or you can pay through your ACH or your bank. But if you want to take it from your Social Security check, you can do that when you apply for Medicare. If you don't apply for Medicare and you're also receiving Social Security, you would just pay out of pocket, for that.
So I have a question as a financial planner, because
Yes.
a lot of people want to retire early, but then there are those who are being aged out of their career, like
Mm-hmm.
technology, certain fields, they're being aged out. So if
Yes.
a person winds up having to retire early at 62,
Mm-hmm.
um, and they sign up for Social Security, get that.
Mm-hmm.
Are you allowed to still work? Because maybe that person, because a lot of people at 62, like they say 62 is now the 50s. So
Yes.
you don't want to sit around and do nothing. And, maybe they want some extra income regardless of Social Security and their
Mm-hmm.
retirement money. They just want to do something and of course get paid. Can
Uh-huh.
you do that and get Social Security, or do you get docked?
You can, but you get docked. So before your full retirement, if you work uh, before or receive benefits and still work before your full retirement age, it is going to be basically what they call subject to an earnings limit test.
Mm,
So each year it changes. I believe this year it was 21,640 or so
mhm,
that you can make before they start taking out basically a dollar for each $2 that you earn of
mm.
income for that. It's not going away. They just basically take it and then they give it back to you in the form of higher earnings when you do reach full retirement age for that.
Oh,
But yes, they do it technically dock you for making a little bit more in retirement. So sometimes people go up to the amount that they're allowed. If you go over that amount, basically it's like a dollar for each $3 you earn above. So it is subject to what they call the earnings limit test if you
Mhm.
decide to work before your full retirement age and receive Social
Okay,
Security.
so that's great for the people who are forced into retirement. They happen to
Mhm.
find something after all that may pay them a bit more.
Yeah. Mhm.
Then that actually works out because I had that question. I know a couple of people who are probably in that situation. But then I also have a friend of mine. He retired early, but it was kind of funny because he's like, I did the calculations and I decided I want my money back now. I'm not waiting to 70 years old. I don't
That's what I hear
be
a
here
lot.
till 70.
Yes.
He's like, I'm calculating because he does have a disease, but I think it's in
Mm.
remission or whatever. But he's like, I'm calculating, I got maybe 5 or 10 summers left.
Yeah, some people they feel that way. It is a what the break even calculation. It's like, okay, some people like take the money and run as soon as I'm eligible, I'm getting it because I may, like you said, it may be a longevity issue that's
Mhm.
involved, and they want to make sure they receive it because basically Social Security doesn't have a beneficiary except if you have a survivor benefit. So if you have a spouse, there's a survivor benefit. But let's say it's just you. Basically, if you pass away before, then it goes back into the pot, basically. So there's no beneficiaries that to a Social Security benefit. So yeah, some people just want to take the money and run because they don't know how many summers that they have left.
Yeah, I think he just wants to golf.
Yeah, some people just want to golf. Yeah, exactly.
Okay, so as a financial planner, what role do you play in helping your clients flesh out the Social Security, Medicare, retirement, all what you call it, the trilogy?
Yes, kind of the trilogy. So those are definitely those topics that come up when I do a financial plan. So in your calculations, okay, how much are you going to get for Social Security? When do you want to take Social Security benefits? If you take them early, like I said, what are we going to be doing with the reduction? Or what do you have access to health insurance at that point? Because I told you that's that gap. If you retire early, any time before 65, the healthcare questions come into play, and then we need to basically factor into your financial plan
Mhm.
paying for health insurance for 2 to 3 years if you retire a little bit earlier. So it's all part of the whole retirement planning scenario. All of these different things come into play. Social Security, your Medicare options as well, and which way you want to go, what is Part B premiums going to roughly cost you, and how much that's going to be on an annual basis. Do you do Advantage? Do you do Original Medicare? How is that going to come out based on your health situation? Sometimes Advantage may come out a little bit on top versus doing Original Medicare. Do you want your own doctors? There's a lot of involved with these
Yeah.
questions, but as a financial advisor, that's what I put. Make sure you have the resources in place when you're dealing with those particular topics because it's an unknown. I just did a Social Security seminar earlier this week with ARP,
Mhm.
and it was let's see, 350 people had signed up for it because Social Security is just such an enigma that really, where do you get information? You can call the Social Security Administration. They basically process your application. They can't tell you when to take it, what's going to be optimal, all of those things. So really working with a financial professional to kind of flesh those out for you is in your best interest.
Yes, and be careful just listening to your friends because a cousin, she was told by a friend that she could retire early, collect Social Security, but if she decides not to, she can, I guess, contact them and shut it off. I believe there is something with a time frame that you can change your mind, but you have to pay the money back or whatever. But
Yeah.
she wasn't aware of that part, or maybe she went past that time frame.
Hmm.
So she was
Yeah.
still kind of like she wished she hadn't done it early because she could have gotten more money per
Mm.
month had she waited. So
That's
you
the
help
way.
out
Yeah.
with that type of stuff.
Exactly. And especially the Social Security Administration gives you what they call a one-time reset.
Mhm.
So within that, it's only a 12-month window. So let's say you, in January, something, you thought you were going to be able to get a job, you didn't. And then all of a sudden you're like, maybe I'll just retire and just collect Social Security. So you go ahead and apply for benefits. And then miraculously, something happens mid-year, something comes up. You're like, hey, I think I want to go back to work. Let me go ahead and suspend Social Security. You can do that,
Mhm.
like I said, because you were within that 12-month window. But the caveat is you do have to pay the money back that you received from that. So from January until maybe June, you would have to pay back those that benefit amount. So
Yeah.
after 12 months, all bets are off, and you can't do that reset anymore after that.
Will they give you a payment plan? Because this, if I'm just like, if you're getting 3,000 a month, then all of a
I
sudden,
know. All of a sudden, I am not aware of a payment program, but I'm sure they would probably work. I mean, IRS has one, so I'm sure Social Security Administration has some type of thing. But yeah, I know it's, and that's why some people go, I don't know. Maybe I should just keep getting it because I don't know if I can pay it
Mhm.
back with that. But that is a good question. I will make sure I research that to see because
Yeah, you
sometimes
would
things
need to have
come up.
gotten a six-figure gig to be able to pay back
Oh
that
yeah, to be able to pay it back.
2,500 easily a month or whatever.
Exactly.
Otherwise, like,
Yep.
come on now, or just, I don't know, or tap into your retirement. I guess that's probably what people probably,
Yeah, that's probably
yeah,
what people do.
yeah.
Hmm.
Okay, I didn't think about that.
Yeah, exactly. But like I said, after that 12 months, it's over, and because it only allowed that one time reset for that.
Okay. Okay. Has she known that? The biggest challenge that you find with people, clients who are dealing with the trilogy that
Hmm.
you have to solve as a financial planner?
Yeah, it's just like I said, the unknown because people go, okay, I want to retire, but what does that look like? And then all of these different moving parts.
Hmm.
Do I take so when should I take Social Security? At what age? What do I have in terms of other retirement resources? That's like I said, it pays to wait if you can wait until 70 if you have an IRA or some other resources that you can tap into to let that bucket in essence grow for you. So that's one of the things that you have to consider or know. Some of the challenges is just not knowing, just like you said with your friends. Like, had I known, then I would have done something a little bit different. So really making sure you do your homework, consult financial professionals if you need to kind of walk you through the different, basically myriad of decisions that you do need to make as it comes to retirement planning, because there's so many options with both of those programs, Social Security and Medicare. And unfortunately, they just kind of send you information. Okay, here you are, you're of age to do it, but they don't give you what I need to do or what's in my best interest to do that. But so that's what I see in terms of challenges is just not having enough education around those particular programs to make an educated decision on which way you need to go with your particular situation.
Yeah. And I would say, as a caregiver, prior caregiver, we were just talking about that with our parents. That was one of the things I didn't worry because my dad had A and B. Then he
Yeah.
had insurance from the company he was
Hmm.
retired from. So that was one thing. Whenever I had to take him to the hospital, I didn't worry about bills, but he did get
Yeah.
20%, but it's retirement money. Social
Yeah.
Security took care of that. So you also give your adult child for that day when they have to step in for you
Hmm.
some relief and less stress because it's already stressful being a caregiver.
Exactly. Really having those components in place, and knowing what to have, as caregivers, like you said before, and having older aging parents, sometimes they don't disclose all of this information to you, and you're just finding bits and pieces of it as you go along and you're dealing with their care. So having these things in place really helps your adult children kind of navigate your care with what they need in terms of, what are you getting for your Social Security check? With my mom, she was getting the check. Unfortunately, she had dementia and she wasn't cashing checks. So we needed to qualify for Medicaid, but you have to have a certain amount. You can't have more than, a certain amount. But then she had these checks that we didn't know about in her bank. And so we had to do something with it. And so we ended up, doing a prepaid funeral, with the proceeds from the Social Security checks that she had been collecting and not using for
Wow.
that. So,
Yeah.
try to basically, as much as you can,
Mm.
um, really give your adult children the information that they need for care.
Yes, and I think give it to them in advance because, like you, I
Hmm.
had to piece stuff together. I honestly didn't know what Medicare Medicare A, B, none of that meant. As
Yeah.
initially, it was just so I would take them to the hospital, and at the front desk, they're like, "Oh," I'm like, "Oh,
Uh-huh.
okay, then that's good. They're not
Yeah,
turning us
that's a good
away."
oh, not a oh.
It was like, "Oh, we're going to be paid." It was pretty obvious that the look in
Yeah.
their faces.
That
I'm
the
like, "Oh," I'm thinking Medicare B must be pretty good. I'm like, "Oh, okay." So
yeah.
it actually inspired me that we're having this conversation,
Mhm.
the relief that I had and not having to do a GoFundMe or tap into
Yeah.
my savings. So I
Mhm.
want up getting a license for insurance and Medicare because I want to help other
Oh
people,
yeah. Mhm.
caregivers like me, to
Yeah.
not be stressed
Yeah, exactly. Like you said, that's a good oh, I get it versus a oh, we don't know.
and not having to do a GoFundMe because
Yeah.
that 20% of medical bills can be
Yeah,
really, it can
a
add up.
lot. It can add up, and that's it. Like I said, it's a co-insurance and not a co-pay. It's not like, 20 bucks, 30 buck type of thing that where people are used to. It's, hey, you got this procedure and it's 10,000 and now you have 20% of that, your portion, and
Mhm.
you get the bill for it. And so having those supplement plans if you need to, or having, retiree health insurance, because sometimes certain companies do provide that for their retirees, so knowing if that's in place for your aging parents as well is really beneficial when you go take them for care.
So I'm guessing it would be probably suggestive someone has an older adult child,
Mhm.
they're coming to you for a consultation. It'd probably be great to have that adult child who's probably going to wind up being the caregiver. That way you could flush everything out with them and educate that person as well. Just the idea that just came to me, like
Yeah, like yeah,
that would be even better.
that would be even better. I mean, yeah, I do have family meetings sometimes with basically more transfer of wealth or generational wealth, but
Mhm.
similar with I have a lot of people who have aging parents, and so having everybody on the same page in the same room or at least on a Zoom or whatever to know what's going on is beneficial as well. So that person is not in the dark and try to have to, like you said, piece everything together because that can be challenging as well as stressful.
Yeah, and make a decision together as a family member. Because I'm also thinking that a lot of older adults sometimes are like, well, I can't afford this. I don't want to get part C or part D or whatever. But if you have five or six adult
Mhm.
kids, they
Yeah,
might decide, you know what, mom, we'll pay for that. We're going to get you all of it. We'll pay for it
exactly.
because in the long term, it's going to save them financially and less stress as well.
hmm That's true. That's true.
Mhm.
You basically hit the nail on the head.
Coming up with like ideas.
Yes, it's awesome.
Like let's save as much stress as possible from the adult caregivers to be.
To be, yes, but we both know it, with parents, especially of an older generation, it's always been keeping stuff close to the best. They don't want to share, how much money you make and everything. And that's the thing about it, is really trying to have these family conversations
Mhm.
earlier with your parents before it gets to a point where it's a challenge. Like I said, my mom was more memory challenged. So we did a lot up front, but then there were still some missing pieces that we had. But if you can have that conversation sooner rather than later, it will definitely benefit everybody.
Yeah, my dad had Alzheimer's and there was money missing, and I still
Yeah,
don't know what happened to it. It's
exactly.
just okay. So, how would a potential client reach you?
Yep. So they can definitely reach out. My website is jacksonsams.com, JACKSONSAMS. It's the kind of the starting spot. They can sign up for a complimentary consultation there to get the ball rolling. I'm also on social media, at Jackson Sam's Wealth on Facebook and Instagram if they want to follow. I put out some really good content, information like this. I am out and about in the DMV and all over doing workshops and seminars as it relates to Social Security, Medicare, retirement planning. So they can just look for me there.
Awesome. Thank you so much for joining us again, Pamela.
Yes, thank you very much for having me.
Have a good one.
You too.